Today on Investigate TV Plus, an already complex and confusing health insurance system could get another layer. I'm Lee Zurich.
And I'm Tisha Powell. We're talking about a change that could have you paying more for your next visit.
For them to change the way they bill it and say that it's a hospital service as an outpatient, it just didn't make sense to me.
Plus, some who face vision loss say many are blind to their struggles.
Just outside of the school for the blind, there was no blind accessible crossing.
Yep.
An in-depth look at the inequities and how the world's most popular sport is building confidence for the blind.
Then she saw a need for man's best friend, how a 9-year-old is making sure dementia patients don't feel so alone.
In-depth stories that inform and inspire. You're watching Investigate TV Plus.
For many Americans, health insurance doesn't work how they expected.
A recent survey found between 2022 and 2023, 45% of insured working-age adults experienced a surprise bill or copayment.
So imagine you have the same doctor, the same insurance, even the same treatment for years, and then suddenly you're slapped with a much higher bill.
Investigative reporter Carice Jackman and partner KFF Health News explained one reason that's happening more often.
I think we are set to go.
Rolling. All right,
I'm going to start recording now on my end.
Recording in progress.
Cervical dystonia and dystonia, other forms, it's very painful. So muscles are in constant spasm and contraction. You know, my head is in constant motion, my shoulder is in constant motion.
Is that why you're holding your neck, Karen, to keep your head still?
So if I remove my hand, my head is going to go to the right, it's going to tilt to the right, and my shoulder will come up.
For 5 years, Karen Blanzy regularly received treatment for her condition at a medical clinic in Grand Rapids, Michigan. Her insurance paid 100% of the cost. That was until February of this year. Instead of her bill saying zero, Blanzy had a balance of more than $1,100.
They said that it was just some changes that they had made. My insurance company said the same, and that it was a revenue code. They had switched from billing as an office visit for treatment, and they switched it to outpatient hospital services.
And there was nothing different about your treatment?
No.
Same provider, same doctors, same nurses?
Yep, same place that I had always gone. Nothing had changed.
Blanzy's clinic is owned by Corewell Health, a big health system that is the result of a merger a couple of years ago. At the end of last year, Corewell announced to patients that some clinics would now be owned and operated by the hospitals. In December, Blanzy got this letter from Corewell Health about the billing changes, stating that she can expect to see 2 charges on her statements from them in the future, and that the clinic will begin provider-based billing. The letter says even though the clinic or practice Blanzy went to may be located several miles away from an actual hospital, the facility itself may be owned by the hospital or considered part of it. Corewell added this is common in large health systems, where the hospital system owns the space and employs some of the team members.
For them to change the way they bill it and say that it's a hospital service as an outpatient, it just didn't make sense to me.
Investigate TV reached out to Corewell Health for an on-camera interview. Corewell confirmed late last year Blanzy's neurology office became a hospital outpatient department owned and operated by Corewell Health Grand Rapids Hospitals, and stated the change was not a result of the merger. But they declined to discuss her case due to patient privacy and didn't explain the coding.
And look at this, look at this nonsense.
Dr. Elizabeth Rosenthal, senior contributing editor of our partner KFF Health News, isn't surprised. She says hospital charges for non-hospital care is a concern she hears from patients all the time.
So she was getting a hospital facility fee charge or a hospital code.
In fact, our partners, KFF Health News, found that the share of physicians working for a hospital or in a practice owned at least partially by a hospital or healthcare system increased from 29% in 2012 to 41% in 2022.
and we see this over and over again, the rebranding of doctors' offices, of outpatient clinics as hospitals for the purpose of billing.
And should the burden of that transition, that change, fall on the patient?
Well, you know, how's a patient to know? One of the hospitals I went to asked patients to sign a consent form beforehand saying, you realize that as of this year, we're going to be charging you a hospital facility fee. But I have to say that was in a hospital. This was not. So I think it's another one of our buyer beware warnings in healthcare.
As for Blanzy, she can't afford to pay over $1,100 every 3 months. Her treatments have stopped, while her contractions and muscle spasms continue every day.
I'd like to see them be more transparent. The bill is mine. I don't think I can do anything about that, but I can't be the only person that this has happened.
So the cost of care is the last thing on a patient's mind.
We reached out to the Center for Medicare and Medicaid Services about this issue. A spokesperson said in a statement, the agency recognizes how this confusion can lead to unexpected bills for patients, and it's working with other agencies to get patients' cost estimates before treatment, particularly for those with private insurance.
Meantime, some states are working on solutions. Maine, for example, has a public notice requirement where providers must notify consumers online and in signage at the facility whether they charge a facility fee. But many states don't have any specific protections. Some advocates are calling for the implementation of what's called site-neutral payments.
So basically, the payment is determined by the treatment you got, not where it was given. So whether it was in a hospital or an outpatient clinic or a doctor's office, it's the treatment that determines the charge. And that just seems much, much fairer than expecting patients to kind of figure out, is my doctor's office now considered a hospital?
But critics of site-neutral payment reforms, mainly hospital industry representatives, believe those requirements could lead some hospitals to scale back or eliminate services at hospital outpatient departments. They also argue it could lead to decreases in revenue for hospitals, ultimately affecting patient care.
You can watch and read more of our in-depth coverage on this issue on InvestigateTV.com, including the rising cost of a medical emergency. Just to search costly care.
Still ahead, the U.S. faces an aging workforce on its farms, how women are filling in that gap and planting the seeds of change.
But first, access allows opportunity. We take you to one of the only blind soccer fields in the country and explain how the sport is gaining momentum on the world stage. Blindness can happen to anyone at any age, and it's a growing public health issue.
About 1 million people in the U.S. are considered blind. That number is expected to double by 2050.
Despite laws like the Americans with Disabilities Act, which are meant to protect people, the blind often face major struggles.
Reporter Kristen Crowley examines their fight for equity.
Our eyes allow us to do so much in the world. But when you're blind, the opportunities can shrink drastically. When it comes down to it, is our country really blind friendly?
No, we're not inclusive of people who are blind.
Access to everyday items is lacking for the blind. More than 90% of all published material, from books to magazines, can't be read by them. Leah Enright at the Kansas School for the Blind, the only school for the blind in her state, says many in the community are an afterthought.
We have to fight to get an accessible pedestrian signal on the corner here at 11th and State, right outside of our campus.
Just outside of the School for the Blind, there was no blind accessible crossing.
Yep.
The barriers don't stop there. Data show 8% of working age people with vision difficulty were unemployed, compared with 4% of the same aged people without vision loss.
We don't have the opportunity sometimes to show what we have.
Is it hard for you to get a job because of that?
Yes, real hard.
Ricky Castaneda, who started going blind at just 8 years old, struggles to convince people otherwise. And you're capable of working.
And always capable of working. I'm capable of doing most things.
So how do you prove to people you're capable? You show them. The blind community will get the chance to do that on the world stage for the 2028 Paralympics, where they'll compete in a sport that may seem impossible to play without vision: blind soccer. It has a way to go before it's mainstream, but it is gaining momentum. I visited the first and only blind soccer pitch in the Midwest to show how this sport for the blind is so much more than just a game.
Ready?
The grass, the ball, the net.
Nice!
You probably guessed this is a soccer field, and you would be half right.
We're the only blind soccer pitch in the Midwest.
For more than 100 years, the Kansas School for the Blind has found a way for its students to play sports.
Wrestling, swimming, goalball, track and field.
But blind sports coordinator Leah Enright says soccer is a first.
Push it with those feet. Push, push, push. Good.
To think about people who are blind playing that sport, it seems impossible.
Sure.
How does it work?
Actually, in blind soccer, you don't want to kick the ball far away. You want to keep it close so you know where it is.
A chicken's egg, and you don't want to smash it, do you?
Beads inside the ball help players find it. Walls keep them from running outside the pitch. And communication
45, I'm center. Come on, Lily.
is key.
When you're playing blind soccer, it's listening, not only for the ball, for your coaches too, and your teammates.
Is it gaining in popularity?
Oh, for sure. I feel like blind soccer is now, we're just at the beginning of stages of people understanding the game.
And understanding that blind people can play it. People like Anna Evans.
I used to be a player at my old school.
And Nolan Shannon.
I just want to be a soccer player.
Anna and Nolan thought their soccer playing days were over when they started losing their vision as young kids.
I looked up in the sky, I'm like, is the sky usually blue? Because I see yellow or red.
Will there come a time where your vision is completely gone?
Yes, actually. It can actually happen any day or any time.
Nolan has night blindness. During the day, he can see, but the vision is blurry. And at night,
I'm just 100% blind. And when I mean blinds, like walk into walls blinds.
For both, playing sports has been a challenge.
I tried baseball. It didn't work out, really. It just didn't work out.
And was that because of your vision?
Yeah.
Their diagnosis meant losing so much more than their vision. You worried you might not be able to play soccer anymore?
Yeah, until I heard of blind soccer.
Ready?
The game is a little different. There are fewer players on the field, it's smaller, and there's no penalty kicks or throw-ins.
Good job, Lily. Keep coming.
But it brings a sense of inclusion for blind players, a feeling they don't often get.
All they see is the cane, right? And all they see is the blindness.
Ricky Castaneda, part of the men's national blind soccer team, will try out for the U.S.'s first Paralympics blind soccer team in 2028, a team that wasn't even a possibility a few years ago, because access to blind soccer and most sports isn't easy.
Around 75% of blind people, or people with disabilities in general, don't have the opportunity to play a sport.
Drive, drive, drive.
Bringing blind soccer to the world stage in 2028 could help change the perception that this disability doesn't mean inability.
I know that I'm a part of a big project of getting blind soccer in the United States, and it feels amazing.
For the blind, living in a world not built for them, all they want is an even playing field. This one is a good start.
You may have noticed the players wearing blindfolds. That's because there are varying degrees of blindness, so this keeps everything equal. Also, there's one player who must be able to see for safety reasons, and that is the goalie.
Maryland and Virginia also have blind soccer fields, but advocates say they'd like to see at least one in every state.
Today, it's estimated there are fewer than 10 blind soccer programs in the U.S.
Still ahead, how a girl's generosity is making patients facing memory loss feel less alone.
But first, how women who farm are making their mark in a male-dominated field.
You can watch Investigate TV Plus anytime streaming online. Get the app for Roku, Amazon Fire TV, and Apple TV. They're free to download.
If you've ever eaten a delicious burger with a wheat bun, savory beef, and zesty cheese, you most likely have a U.S. farmer to thank. According to the most recent data, about 90% of our money spent on food is for goods produced right here in the U.S.
I'm still thinking about that burger you described.
It sounds good.
It does, yet the people who grow the food that ends up on our plates face an increasing challenge. According to the U.S. Census of Agriculture, from 2017 to 2022, the number of farms in the U.S. dropped 7%.
A major factor? An aging workforce. According to the USDA, the typical American farmer is 58 years old.
That same survey revealed a demographic that's growing in the agriculture industry: women.
And here's how some women are already sowing seeds of change in a male-dominated field.
Yeah, it's so nice, baby.
It's March 2024, and calving season is just getting started at JC Farms.
Gotta put a tag in your ear.
These are the first of 300 calves Jackie Chrisman is expecting.
It's like a passion, I love it.
This is a life Jackie says she dreamed of living. She grew up on a ranch, married a farmer, and added cattle to his North Dakota operation. When it comes to the cattle, she's in charge.
I think I have 3 or 4 sets of twins.
Jackie is one of a growing number of women working full-time on ranches and farms.
More and more women are like, hey, this is our livelihood too. Let's be involved and let's take credit for it too.
According to the most recent data, women make up 36% of farm operators, a 23% increase from 2017. In Texas, women make up 39% of farmers and ranchers, a group Vanessa Wood has been listening to for decades.
It's not easy, growing up in agriculture. It's not easy working in agriculture. And so people who are not familiar with agriculture don't understand the adversity that we have to face.
In 2021, she created a space to bring these women together.
Ag Women Connect is America's platform for women in agriculture to come to share their thoughts, ideas, and their stories.
Vanessa's holds virtual group conversations that started with a podcast and has since blossomed into regional groups on social media. Starting membership for professionals is $100 per year.
We're going to help you cultivate those relationships. You never know who you're going to meet in that network, who can help you throughout college and your career.
She says any woman in agriculture is welcome, from those working on a farm since birth to women putting boots on for the first time.
And so we just take all of that and, we want them all to be together and we want to work with them because honestly, that's just how agriculture is going to grow.
Back in North Dakota, Jackie Chrisman now documents her day-to-day work.
Start coming to the gate about 3 o'clock.
She started her social media page to educate people about the work that goes into running a farm and cattle ranch.
11 calves born out in the lot today.
Just like Vanessa, she hopes exposure will cultivate an interest for the next generation of women. Still ahead, the perfect pet.
He's still, I don't have to chase him, I don't have to clean up after him or feed him. So what better could you have?
An inspiring idea behind these faux furry friends.
Many of us spend a lot of money ensuring our pet has a long and healthy life, but research shows they may help us live longer. A 2023 study of nearly 8,000 adults found pet owners were more likely to experience slower rates of memory decline.
While live pets may not work in most nursing home facilities, a 9-year-old girl found a way around that in an effort to bring a similar kind of companionship to some residents.
Reporter Marissa Burke shows us how.
All right, Miss Louise, we would like for you to adopt an animal today. What are you thinking?
She's not talking about a real pet.
Their bellies go up and down so that you can see that they're breathing.
These stuffed animals come from a 9-year-old girl and her mom. Their nonprofit is called Evelyn's Blessings.
I have so much joy from this, and I love it so much.
The idea came after multiple trips to Evelyn's Poppy at a long-term care facility that takes care of dementia patients. Evelyn and her mom Jennifer noticed many residents didn't get any visitors, so they found a way to bring companionship to them.
He's still, I don't have to chase him, I don't have to clean up after him or feed him. So what better could you have?
Evelyn believes each pet removes the loneliness residents may be experiencing and replaces it with joy. Her favorite part is the surprise.
I show them what they're here for, and then they're so happy.
This 9-year-old's generosity is also helping her reach milestones. Her mom says she's the youngest nonprofit holder in the state of Indiana.
I tell her all the time that she's the little girl that I wish I could have been when I was younger. And just seeing the drive that she has and the compassion and the love that she has for the elderly it's just unmatched.
Their goal is to visit as many long-term care facilities so even more residents can feel Evelyn's heart.
I pet him all the time. He's a sweet thing.
Through Evelyn's blessing.
I will say this, those looked like real animals in a way, right?
They did, and they're soft and they have the same effect, companionship.
And it definitely is working there. Very nice.
Well, that's it for us on Investigate TV Plus. I'm Tisha Powell.
And I'm Lee Zurich. Thanks for watching. On the next Investigate TV Plus, hunching out Parkinson's disease.
I sometimes imagine a big PED on that bag. We have more information and data, specifically in Parkinson's, and we know it makes a big difference.
An in-depth look at how breaking a sweat could slow or even prevent the disorder.